Welcome to the MRCS Bites session on spleen. Today, we'll dive into this topic and explore the common questions tested during the MRCS Part B exam. For more information and full course, please visit mrcsbites.com. Describe the anatomical location and relations of the spleen. The spleen is located in the left upper quadrant of the abdomen, specifically in the left hypochondrium, beneath the diaphragm and behind the stomach. It lies adjacent to the 9th to 11th ribs on the left side and is protected by the rib cage. The spleen has close relations with several structures: anteriorly with the stomach, medially with the left kidney and tail of the pancreas, inferiorly with the left colic flexure, and posteriorly with the diaphragm. What are the main functions of the spleen? The spleen has several important functions in the body. Filtration of blood. The spleen removes old and damaged red blood cells and platelets from the bloodstream. Immune response. It acts as a secondary lymphoid organ, where white blood cells, mainly lymphocytes, monitor the blood for pathogens and initiate immune responses. Blood storage. The spleen stores a reserve of blood and can release platelets and other blood cells into circulation during times of acute blood loss. Recycling iron. It salvages iron from hemoglobin of old red blood cells, sending it to the liver for recycling. Describe the blood supply to the spleen. The spleen receives its blood supply from the splenic artery, which is a branch of the celiac trunk. The splenic artery follows a tortuous course along the superior border of the pancreas before entering the hilum of the spleen, where it branches into several smaller arteries. Venous drainage of the spleen is through the splenic vein, which joins with the superior mesenteric vein to form the portal vein, directing blood towards the liver. What is the structure of the spleen and its histological components? The spleen is enclosed in a fibrous capsule and internally divided into two main regions: red pulp and white pulp. The red pulp contains sinusoids filled with blood, which are responsible for filtering old red blood cells and storing platelets. The white pulp consists mainly of lymphoid tissue organized around central arteries and is involved in immune surveillance. The white pulp contains lymphocytes, which can respond to blood-borne antigens, while the red pulp handles the filtration of blood cells. What clinical conditions can affect the spleen, and how do they present? Splenomegaly. An enlarged spleen often seen in conditions like liver disease, infectious mononucleosis, or hematologic disorders, e.g. leukemia. Symptoms may include fullness in the left upper abdomen and sometimes pain. Ruptured spleen, commonly due to trauma, e.g. blunt abdominal injury, leading to internal bleeding and potentially life-threatening hypovolemic shock. Signs include left shoulder pain, Kehr's sign, and hypotension. Hypersplenism, an overactive spleen that destroys blood cells excessively, leading to anemia, leukopenia, or thrombocytopenia. Splenic infarction, caused by obstruction of blood flow to the spleen, often due to emboli or sickle cell disease. It can present with sudden, sharp left upper quadrant pain. For more MRCS Part B resources, please visit mrcsbites.com.